the government of Zambia's action to combat medical drug theft and strengthen Zambia's healthcare supply chain. The Zambian government acknowledges the concerns raised by the Ambassador of the United States of America to Zambia regarding recurrent thefts of medicines. The Zambian government wishes to reaffirm its commitment to resolving this unfortunate issue. The government has been very systematic and very careful in taking steps to deal with the matter. However, we express our profound gratitude to the American government and the people for their generous support, which has significantly strengthened Zambia's healthcare services, particularly in the fight against HIV, AIDS, malaria, and other public health challenges. The thefts of medicines jeopardize public health, depriving patients of essential treatments and undermining confidence in Zambia's healthcare systems. This persistent challenge reflects a deep-rooted problem that took hold long time before the current administration assumed office in August 2021, stemming from systematic weaknesses in oversight and supply chain management under previous governments. To address this, the government of Zambia has implemented robust remedial measures to protect medicines, ensuring that they reach the patients who need them most. You may wish to note that the President of the Republic of Zambia, Mr. Hakainde Hichilema, commissioned a comprehensive independent forensic audit of the entire medicine supply chain immediately the concerns were raised. This audit was commissioned by the Auditor General's Office and conducted by PricewaterhouseCoopers. The interim report was shared with stakeholders, including cooperating partners at State House, at the invitation of the President. Following the preliminary report, the government of Zambia took the following actions. 1. A number of ZAMSA officials were suspended and or removed from the positions, including the Director General, Mr. Victor Nyasulu, the Director Supply Planning, Miss Narishebo Siyandi, the Director Procurement, Mr. Chimunya Habantu, and the Director of Finance, Mr. Milimo Ngururu. You may wish to note that other than Director of Finance, those officials are appearing before the courts of law. The final report has been completed and cleared by the Office of the Auditor General for further action. Note that there will be no sacred cows in this process. However, all the suspects will go through the entire legal process with the presumption of being innocent until proven guilty by the competent courts of the law. The government of the Republic of Zambia urges the Ambassador of the United States of America to Zambia to share any additional information that may be useful for action or prosecutions. Further, DEC, that's Drug Enforcement Commission, has intensified its operations, leading to the arrest and prosecution of additional individuals in the thefts of medicines. To enhance oversight, the government has established a joint national drug task force to conduct real-time monitoring, early detection, and prevention of theft across the supply chain. In its quest to improve visibility of the supply chain system, SAMSA has implemented an advanced digital stock tracking system. The system enables real-time monitoring of medical inventories, ensuring accurate record keeping and reducing diversions and or theft of medicines. To ensure long-term sustainability, the Ministry of Health, ZAMSA, and key stakeholders are set to convene next week in the Copper Belt for an annual planning exercise to assess Zambia's medical needs for 2026. This strategic session will focus on optimizing resources allocation, strengthening supply chain security, and guaranteeing the availability of essential medicines for all Zambians. We wish to assure the public that Zambia currently maintains sufficient stocks of essential medicines, including antiretroviral, anti-malaria, and other critical drugs with no immediate risk of shortages. And this government national essential drug availability has increased from averages under 35% to well over 75% countrywide for primary care. The government is engaged in dialogue with the US government to address their concerns, implement robust solutions, and maintain the strong partnership that underpins our healthcare progress. The government is committed to transparency, accountability, and justice in delivering quality healthcare to every Zambian. By working together, we can protect our healthcare system and ensure that medicines reach those in need. The government under the President Hakainde Hichilema has ensured that there is transparency, accountability, and as you can see, that senior management, the whole entire senior management has been removed, and even the board was dissolved. And this fight goes without victimizing anybody and rushing the arrests that will end up acquittals. The government of Zambia is strictly adhering to what it intends to be a stringent measure. I thank you.